You know, cancer touches everyone, which is why it's easy to see strong bipartisan support for House Bill 134. This bill would require health insurance plans other than Medicaid and self-insured to provide coverage for supplemental breast cancer screenings like MRIs, contrast mammograms, and ultrasounds. This would apply only to patients who are at high risk for breast cancer and clinically require additional screening. Like that'd be Bill's sponsor, Brooke Green, who was diagnosed with breast cancer in July, just 2 weeks before an embryo transfer to grow her family. Well, now, instead of that, she's going through breast cancer treatment. She said through this process, she realized women in Idaho are at a heightened risk because they aren't getting the necessary treatment, mostly because they just can't afford it. So she's trying to change that, and the co-sponsors of the bill are also trying to change that. They're also wearing pink today in support.
This is a fiscally conservative bill. You cannot argue against the fact that catching cancer early results in a better cost to the payer than catching it at 2, 3, or 4. My mastectomy cost $137,000. My follow-up chemo, a couple $100,000. My radiation, a couple more $100,000. Had I had advanced screening early on, the MRIs, the contrast mammogram, maybe I wouldn't be in this situation.
I remember when my son was 11, one of his best friends lost his mom to breast cancer because it was detected too late. And that boy looked so lost. And I hope that with this bill, we will see fewer such funerals and fewer empty seats at the tables.
After a few more emotional people participating in the debate, the bill passed with just 6 voting against it. And you can see the emotion on Representative Green's face, too, watching that bill pass and advance, and now heads to the Senate for a committee hearing.